An international health emergency is in effect over an outbreak of an Ebola strain in the Democratic Republic of Congo and Uganda. It has killed more than 80 people so far in Congo so far. Fears of further spread grew when authorities confirmed a case in country's biggest city, Goma, which is controlled by the M23 rebels. Meanwhile, the U.S. Center for Disease Control and Prevention is mobilizing response efforts following an Ebola outbreak in the Democratic Republic of Congo and Uganda, supporting partners withdrawing a small number of directly affected Americans. Earlier, U.S. media reported that a number of Americans currently in the DRC are believed to have been exposed to suspected cases. The latest development comes as Congo is battling a rapidly spreading outbreak linked to the rare Bundibugyo strain of the virus. It's a strain for which there is no currently approved vaccine. Clinical symptoms include fever, bleeding, and multi-organ damage, and the disease has a fatality rate as high as 50 to even 90%. The outbreak in the DRC has so far been centered in Ituri province in northeastern DRC, near the country's borders with Uganda and South Sudan. Containing the outbreak here is complicated by the constant movement of people. There's a lot of gold mining activity in the province, which also suffers from regular attacks by the armed groups active in the region.
It is an epidemic that will spread very rapidly, all the more so as it has broken out in a densely populated province, with a high concentration of people and a great deal of population movement. And then, of course, there is the added complication that there are many armed groups in this province. That is what will make managing this epidemic very, very, very complicated.
According to health officials in the DRC, at least 88 people have died, while more than 300 suspected cases have been reported. The virus has also crossed borders, with Uganda confirming a related death. The World Health Organization said the outbreak did not meet the criteria of a pandemic emergency, but there was a high risk the disease could spread further to countries sharing land borders. Experts believe fruit bats are the natural carriers of Ebola, though interestingly, the bats themselves do not fall ill. The virus can also spread through other infected animals such as apes, antelopes, and porcupines before being transmitted to humans. Human-to-human transmission happens through direct contact with the bodily fluids of infected people, including blood, vomit, and other secretions. Traditional burial practices involving physical contact with the victims have also contributed to Ebola spread during outbreaks. Unlike some respiratory diseases, Ebola does not spread through the air. However, once infected, patients face a very high risk of death. For more on this, our correspondent Louisa has sent us this report from Lagos in Nigeria. Take a look.
Bundibugyo Ebola strain is tearing through eastern Congo with over 300 suspected cases and more than 80 deaths already recorded. The crisis is shifting rapidly, with WHO declaring it a public health emergency of international concern. The virus has officially breached borders, with cases confirmed in neighboring Uganda and a newly discovered infection in the major hub of Goma. Sadly, unlike previous outbreaks, there is no approved vaccine for this specific strain yet. With armed conflict blocking medical teams and borders now closing, health workers are racing against a clock that is ticking faster by the hour. From Lagos, Nigeria, Louisa Olaniyi, WION this one.